My name is Julie McDonald. I'm the Director of Communications at the Orange County Healthcare Agency. And today's press call is intended to provide an update for all of you on the situation in Orange County regarding the high volume of pediatric cases of respiratory infection, which has prompted the issuance of a declaration of health emergency. Joining us this afternoon to address your questions and to give us an update is Dr. Chinsio-Kwong, known as Dr. CK. She is HCA's Chief Medical Officer and the County Health Officer here with the Orange County Healthcare Agency. We also have with us today Dr. Melanie Patterson. She is the VP Patient Care Services and Chief Nursing Officer at Children's Hospital of Orange County, and also Dr. Singh, who is a Medical Director at CHOC Infection Prevention and Epidemiology and is a pediatric infectious diseases subspecialist. So with that, I'm going to ask Dr. CK to start us off today by sharing an overview of the situation in Orange County. Dr. CK, to you.
Thank you. Good afternoon, everyone, and thank you so much for joining us. As you all heard, I did put out a declaration of health emergency in response to respiratory illnesses, which have been causing a significant portion of pediatric patients to be hospitalized. In Orange County, we have a unique situation in that we have few dedicated hospitals that are here in Orange County dedicated to caring for our pediatric patients. Children's Hospital of Orange in Orange is our main hospital that provides the majority of care for our pediatric patients. And they also have a branch CHOC at Mission Hospital, which has a couple more beds that are available for further cases. There are a few other hospitals that do care for pediatric cases, but they have limited beds. And what we learned late last week and into the weekend is that both CHOC locations have been operating at or beyond their capacity to care for pediatrics with respiratory illness. And we know that we want to make sure we have the ability in Orange County to take care of any sick child who falls ill from any respiratory illness. And we want to make sure that other hospitals prepare to operate in surge capacity in the event that is needed. Respiratory syncytial virus is a common virus that affects young children, typically around this time, late fall into February. But this year has been unique in that it has already risen throughout the summer and has been at higher levels than we expected compared to previous years. And I know that Dr. Singh has more data that she can share later on. Our concern here is that it is reaching even record levels that from earlier in the year, and we have not even seen the beginning of our flu surge. So we want to make sure we are prepared to care for any sick child in the county who falls ill and requires hospital care, but we want the public and other local health systems and hospitals and urgent cares to also be prepared to assist and care for children and families who have respiratory illness and may not need an emergency room visit or hospitalization. There are other things that we can do also as a society, as in the environment. We can protect ourselves. We've learned in the last 2 years that the very things that we did to protect ourselves from COVID were the things that also protected us from getting a lot of flu cases and RSV cases. And that includes using your typical mask wearing when you're indoors around others who are outside of your household, practicing good hand hygiene, respiratory hygiene. Even if you don't have COVID, know that any respiratory type cough or illness doesn't have to be COVID. It can be another viral illness that can also cause severe injury to someone who's at risk. So we can all do our part to minimize the risk of people catching these viral illnesses and impacting our local hospitals. With that, we put the declaration for health emergency, again, to heighten awareness and preparedness for our local hospitals and health systems and medical offices, and to also increase local support to the main hospitals and providers caring for our pediatric patients. And also it gives me the authority in the event that it is needed, hopefully it won't be needed, but if it is needed for me to require certain hospitals that don't typically care for pediatric patients to care for them if and when we need it. Julie, I'm going to have you go ahead and show some slides of actually what our numbers are. Or actually, maybe I'll just jump over to Dr. Singh to give her portion of the perspective from the CHOC on the ground in the hospital.
Sure, thank you. Good afternoon, everyone. What we're experiencing are high numbers of children with respiratory viral infections. And as Dr. CK mentioned, many of those are kind of out of sync with what we usually see in terms of seasonal patterns. The virus that's really causing a big surge in our numbers right now is RSV, but we are also seeing other respiratory viruses, still some COVID. We're starting to see some flu upticking and a whole host of other cold and cough kinds of viruses. So in a normal pre-pandemic year, our RSV season would be December through February. And what we are experiencing is a very high volume of RSV infected children right now. So in a normal pre-pandemic year, 1 to 2% of babies with RSV under the age of 6 months might need hospitalization. And really almost every child has gotten an RSV infection by the time they're 2 to 3 years old normally. But of course, for the last few years, as Dr. CK mentioned, we've been doing things like masking, social distancing, we've had school and daycare closures and other precautions during the pandemic. And so that protected all of us from COVID, but also protected all of our kids from exposure to these other respiratory viruses like RSV. So we now have our children who are 2 and 3 years old who really haven't been exposed to these viruses and haven't built up immunity. And the viruses are kind of playing a little bit of catch up with that. So we do have a large number of RSV infected children in the hospital right now, much more than we would normally have at this time of year. Today we have 65 in-house, 11 of whom are in the ICU.
Thank you. And actually, to help visualize this, I know I'm a visual learner, so sometimes seeing slides helps. So Julie, can you show the CHOC data on the current cases? And I'll have Dr. Singh walk us through what CHOC has been experiencing and what this table actually is showing us.
Yes, it's a little busy, I know, because we've been trying to look at every single virus over the past year. That gray line kind of untidily looping up there is COVID. So you can see how that's gone through our various waves. The black line is rhinoenterovirus, and you can see that about a month ago, we had a lot of children with those types of kind of more routine cold viruses. RSV is the red line, and you can see how it has just shot up in the last couple of weeks.
Thank you. And what this table also shows you is that, again, that the staff over at CHOC have been doing a whole lot of work throughout the summer. And typically summer is a quiet time in the hospital, especially in pediatric hospitals. But this summer, the late last summer, we've had a significant number of cases requiring hospitalization from rhinovirus and enterovirus. And we're just coming off of that. And now we see this RSV rise. And then you're also starting to see flu pick up. So the concern here is that the staff who have already been at surge capacity, who've been working through the summer, are now going to have to bear down and work through this fall and into the winter. And again, we need to do as much as we can on the public side to reduce the strain on our local hospital system. And I hope this becomes more, I don't know, when I look at this graph, I'm concerned with what the future holds for all of us. Julie, if you can go to another slide with just the flu cases. So this is our influenza season. And if you look at previous years, our baseline at 40 and the black line already shows that we are already well above our baseline of the initial influenza activity. It's already rising well above and before what we were used to in the past. And so again, this is concerning in that if we're continuing to deal with our pediatric hospitals dealing with both RSV and influenza, we're in trouble. And typically those two viruses do affect our younger kids, and there's only so many beds that a pediatric hospital has to care for the very sick. Next slide. This is the levels of respiratory syncytial virus testing that we receive as a county. And as you can see, the numbers are just rising through October. Next slide. And then this is the influenza testing, which we already know is starting to pick up here in October. So again, we're looking at both RSV as well as flu. And I realize that right now, a lot of people are utilizing the CDC community levels of COVID to determine if they are going to wear a mask when they are out and about and indoors. But unfortunately, yes, I mean, good, I get fortunately, but unfortunately. So fortunately, our COVID numbers are low. Unfortunately, we are also dealing with other respiratory illnesses that one can also have. So when you have a runny nose, a fever, a cough, it does, and your COVID test is negative, you can still be carrying a viral illness that can cause severe illness to the point of causing someone who is at risk to be hospitalized. And what we want everybody to do is be preventive, take measures now to reduce the risk of transmitting other respiratory viruses in the community. Thank you. So I'll turn it back to Julie. I think I presented all the information that I needed to present. And unless Dr. Patterson, did you have anything else to add?
So I do. I think I wanted to provide a little context to some of the information you provided. And of course, both CHOC at Orange and CHOC at Mission are seeing unprecedented volumes, both inpatient and in our emergency departments. And in fact, last year on this day, today, November 1st, we had 188 patients in our hospital. Today, right now, we have 285. So that is a gigantic surge for us. At CHOC Mission, they are a 54-bed children's hospital within Mission Hospital. They had 28, a census of 28 last year, and they're at 43 today. So they're pretty close to their capacity at 54. Our emergency departments are both seeing hundreds of patients at Orange, and certainly a surge at Mission. The increases really began in mid-August. Since August 22nd of this year, we're seeing more than 350 children a day, with that being more than 400 almost every day the last 2.5 weeks. We've expanded our emergency department capacity in Orange. And on the inpatient side, both of our hospitals are utilizing all space we can to meet the demands. We've convened our hospital command center. We had one for a very long time for COVID, and in fact, we still do. But now this is not just about COVID, as you've seen the graphs. And so we've transitioned that command center into a winter surge command center to ensure we have a well-coordinated response. Our providers and staff are committed to providing safe, high-quality care in every space we have children. On behalf of both Dr. Singh and I think we just want to end with encouraging everybody to get your flu shots. That's the one thing everybody can do. To stay home if you're sick, keep your kids home if you're sick. Wear masks indoors and in crowded outdoor areas. I'm going to say it again. This is not just about COVID anymore. Wash hands well and often. And let's get everybody eligible in your household vaccinated and boosted against COVID-19. Thank you.
Thank you. So we're going to turn it back to Julie.
Yeah, thank you so much, Dr. CK, Dr. Singh, and Dr. Patterson. We are super excited that you were available to share some information today. So thank you for that. Members of the media, we're going to ask that you now, we're going to give you a chance to ask some questions. You can do so by raising your hand, and we'll call on you and put you in a mode where you can be unmuted. Ellen is going to help us go through the list. We have some limited view on everybody, so when you're called upon, we'd ask that you state your name and your media connection and or media platform, and then we'll start the questions. So Ellen, if you could go ahead.
Great, thank you, Julie. So as you know, we will invite you to raise your hand with your question. I will call your name. We ask you please have your question ready to go, as you will be given the floor to ask your question. We'll re-mute you once in order to give our panelists the opportunity to answer. If your question is for a specific panelist, we ask you address them by their name at the beginning of your question along with your name. And if you have a general question, our panelists will answer it openly, and we will let you know once the press conference is closed. Thank you. So we will now commence. The first question we have on deck will be from Sandra Mitchell. Sandra, the floor is yours.
Hi, thank you all for taking our questions today and for holding this news conference. It's Sandra Mitchell from KTLA 5. Thank you so much, doctors. My first question will be for Dr. Patterson. Dr. Patterson, I just want to make sure that I understand. You are seeing more than 400 pediatric patients a day in the emergency rooms at Orange and Mission CHOC, is that correct?
So at CHOC Orange, we're seeing more than 400 patients a day. Yes. At CHOC Mission, it's less than that. Their pediatric section is smaller, but they are surging also.
And my follow-up question to that would be, we talk about numbers, but what is it really like inside that emergency room? Are we hearing children coughing, crying? Are parents concerned? What's it like for the caregivers and your professional staff inside?
Thanks, Sandra, for asking. Yes, we if you walk through the lobby, you will see sick kids. As you know, we all know as parents and grandparents, it's hard to see kids sick, and you're going to see a lot of them when you walk in the lobby. We try very hard to get all the patients triaged and screened into the right place in the ED to get them in and out very quickly. You know, most of our patients come in, get assessed and treated and can go home. But about 15% of our patients will be admitted. And so those, of course, are in the ED for a longer period of time until we can get them a bed up on one of the units.
Great, thank you for your question, Sandra. We will now move on to Ron Lin. Ron, the floor is yours.
Hi, can you guys hear me?
Yes,
Great.
go ahead.
Doctors, thanks so much for talking with me, with all of us. Can you quantify, in the press release, you guys mentioned that pediatric hospitalizations and daily ER visits for respiratory infections are at record levels. Are they record levels for this time of year or record levels period going back to when? And when you mentioned that, you know, capacity is being affected at the pediatric hospitals, can you talk about whether you're trying to transfer patients right now outside of the county and you know, where you're seeking to transfer them? And then also, like, are you suggesting that people ease up on parties or gatherings of young children? And then I just wanted to, I had a question on numbers. Dr. Singh mentioned 65 RSV patients in-house, 11 of whom are in the ICU. Is that at the main CHOC hospital or is that for the both facilities? And then there was a graph that showed 186, and I just wanted to square up those numbers. Thank you.
You want to start, Dr. Singh?
Sure. There were a couple of questions there. Let me see if I got all of them, but in terms of the numbers in-house, yes, 65 in-house, 11 in the ICU. The 186 is for the week, and that's inpatient and outpatient. Those are total numbers. And let's see, some of the other questions that you asked were about transferring out. I will let Melanie answer that. And then we can go back, of course, if we need to severe RSV symptoms.
So Ron, I first want to clarify. So we have 285 patients in the hospital right now. So Dr. Singh's 65 and 11 are part of that 285. Just to be clear. We try very hard not to transfer kids out of the county. In fact, we are getting called day and night to transfer kids into the county to CHOC. We have a great transfer process. We have one of the busiest emergency transport teams in the country, and they are busy 24/7 trying to get the sickest kids back here to CHOC so we can care for them. So the answer is no, we are not trying to transfer out of the county. We are trying very hard to care for all the patients that come into CHOC.
Great, thank you for your question, Ron. Our next question comes from Beth Slept-Pause. Beth?
Here, guys, this is Darsha Phillips with NBC4. My first question, any of the doctors can answer. What particularly is the treatment for RSV, and are there any concerns that we had during COVID for ventilation shortages and things like that that we're preparing for?
So in terms of RSV in particular, usually RSV in adults and children causes cold symptoms, basically cough, runny nose, that kind of thing. Sometimes in very young babies, we can get symptoms like apnea, which means that they stop breathing. In general, it's a disease that's harder on the very young and the elderly because for a few reasons. In infants, as we mentioned, they are particularly immunologically naive this year as they encounter these viruses, but also because their airways are small and RSV causes a lot of secretions, and that can clog things up. They're not strong enough to cough all of that mucus out. So that mucus can sometimes cause inflammation and what we call bronchiolitis, inflammation of those little tiny airways of the lungs. So that's one of the more common complications of RSV that leads to hospitalization. And of course, another one is pneumonia. So those are some of the things that we worry about in particular for RSV. RSV is transmitted by droplets, but also by contact. So although ventilation in general is a good thing in our spaces everywhere, and we're lucky that we can do more things outdoors with our weather, RSV does get transmitted more than, say, COVID by contact with secretions, with other things.
Great. Our next question comes from Chelsea Edwards. Chelsea, go ahead.
Hi, can you hear me now?
Yes.
Great, thank you so much for doing this. We're hearing the term tridemic emerge when talking about RSV, the flu, and COVID. Is that an appropriate term to be using at this point? And if not, how else would you classify what we're seeing right now?
So a tridemic is really just the convergence of having RSV, flu, and potentially COVID-related illnesses, causing significant rise in cases throughout a community. And right now, what we're seeing is, yes, RSV is significantly impacting at least our very young, and potentially can impact also our very old. And we haven't yet gotten there yet for flu, but there is a potential that in a month or so, we will see a high level of flu cases as well. So again, the hope is that with this press conference, everybody is more on alert to do their part in protecting themselves against respiratory illness, but also protecting their loved ones by using all the preventive measures we've been practicing these last 2 years. I also want to address, there was a question earlier on about, well, what are we asking families to do with kids this fall and winter to reduce their risk of getting sick? I think what we do know is that it's important for all of us to socialize and be amongst friends and family and relatives. So what we're asking you to do is, when you do so, be more cautious and careful, meaning when you're indoors, wear your mask, use good hand hygiene. If you're sick, stay home. So it's not that we're saying stop meeting up and having fun and seeing family and friends. It's meaning we want you to be careful when you do so. Thank you.
Great. Our next question comes from Alyssa Starr. Alyssa, the floor is yours.
Hey there. Thank you guys for doing this. I'm just curious because you were talking about, the 15% of patients that will be admitted out of the groups that you are seeing, but what are wait times like for parents right now as they bring their children in? I've had that middle of the night scare with my own child of bringing them in, and I'm curious sort of what that's been like with this surge.
It's a really good question, Alyssa, and it's hard to answer because it really just depends on the day and the time and all the other things happening in the ED. We are a Trauma 1 designated pediatric facility, and so we do get the traumas in from EMS, and we get a high number of just EMS non-traumas. We also get transfers from other facilities, whether they be trauma or just very sick kids from both ground and air. We do have a helicopter on the roof with a 24/7 pilot and a transport team. So we're getting patients from all different directions, and the mom with that child in the lobby, they don't always see all those things. So it can get a little bit frustrating. But our wait time can be anywhere from 4 to 12 hours, just depending on what's going on. We do our very best that when a child comes into the lobby with their parents, we screen them right away. If they're very sick, we're going to take them back right away. And we also have nurses. If you walked into the CHOC lobby today, you would see at least 3 or 4 stations of expert nurses and techs watching the lobby to make sure everybody's okay. And so even if you're in the lobby, we are watching and ensuring that everybody stays out of danger while they're waiting for a bed in the ED.
That's great. And I'm so sorry if I could ask just one follow-up question about what exactly the health emergency declaration does. Is Orange County seeing such a huge surge that this is necessary in order to make sure that you can care, or do you feel like the surge is still coming? Like, are we going to see something much worse in a month?
So this declaration does a combination of things. One, it just makes everybody aware of the situation on the ground, because we're in sunny California and people are not realizing how impacted our 2 children's hospitals are. And hopefully from this call, you're really hearing that it's going to be a long while if you're going to go to a local ER and your child is needing immediate attention. And also our CHOC has been getting a lot of resources from external staff to support the continued care of those sick patients and with their increased capacity. So what this declaration does is it allows for, if and when they are not able to fulfill all their needs for staffing, it gives us a little bit more support also from the state, hopefully, and local, and it gives us some local support also for additional support in terms of staffing. It also allows for waivers to allow hospitals that may not typically take care of pediatric patients to take on some of those cases to offload from CHOC. So that's really what the declaration does. But again, we're also hoping that the community gets involved to reduce the potential amount of cases coming up in the upcoming weeks by doing their part to reduce illness. The other thing you can do, again, so flu is something that is preventable. We do have a vaccine available. So those, especially who are high risk, we're recommending get a flu vaccine. And flu vaccine is approved for anyone who is 6 months and up. And again, as you heard, RSV can also affect the elderly. And we also know that there are 3 specific flu vaccines that have been authorized for those who are 65 and older to give them additional protection.
Great. We just have a few more. Our next question is from Amy Taxon. Amy, you're on.
Thank you so much for having this. I have a couple of questions. I wanted to see if you could please clarify again the total pediatric bed capacity, or I guess the total pediatric capacity for CHOC's hospitals in Orange County, and what % are currently occupied. And then I'd also like to know, it sounds like the idea of this emergency is to allow the non-pediatric hospitals to kind of support and fill in gaps as needed. What is the capacity looking like right now in those hospitals that are also kind of getting ready for flu season and COVID and everything else? And then my other question is, Is what we're seeing in Orange County different from what's been reported elsewhere in Southern California or the state or the country? We know this is starting to happen everywhere. Are you seeing this, is it more exacerbated here, or is this really just something we're going to see everywhere this year?
Would you like me to start? All right, well, let me talk a little bit about the capacity of CHOC. So CHOC Orange currently has a capacity of 334 beds. 104 of those beds are neonatal. And so we obviously can't put a 10-year-old RSV patient, and we are seeing older RSV patients into a NICU. We have made a lot of changes, notable changes to try to increase our capacity, partnering with CDPH, our county, to get waivers to put beds in different areas so we can manage that capacity. So our bed availability changes almost weekly depending on what we're expanding, but we are very, very close to capacity, if not over capacity, at CHOC Orange. At CHOC Mission, we have 54 beds. 22 of those beds are neonatal. And so when you look at their census, they are very, very close, if not over their capacity also. I think you were asking about other hospitals. There are a few hospitals in our county that do have small pediatric programs. My understanding when we looked at those numbers just yesterday, that most of them were at capacity also. CHOC really had the only beds available, which were very few. And last, I don't think we're different than what you're seeing back east or Midwest. We're all experiencing the same surge. We do know that those surges do move from the East Coast to the West Coast. We've learned that almost annually, seasonally. And I think we all know that this surge will probably get worse before it gets better. So we're doing everything that we can to plan and put plans in place to ensure that we can care for every single child in Orange County.
So I'll just add to that, yes, in fact, other children's hospitals throughout the country have been feeling this strain with the increased respiratory viral numbers, particularly RSV. So our situation is not unique that way. I also want to mention something I think that Dr. Patterson and I really want to make sure that everyone understands. If, you know, the ER is busy, the hospital is busy. Yes, there are long wait times, but if your child is ill, if they have RSV bronchiolitis and are having respiratory difficulty, you should bring them in. And as Dr. Patterson mentioned, they are being triaged by level of acuity so that they will be cared for immediately. And the treatments for RSV are mostly supportive, but in the hospital can involve things like oxygen, suctioning, hydration, things like that. We can definitely do things to make the child feel and get better. So if they are ill, they should still come in, absolutely. And lastly, Dr. CK, just one other plug. Please make sure your child is up to date on their routine vaccines as well. We've been talking a lot about respiratory viruses, but remember that, gosh, in the middle of all of this, we really don't need to see increased measles, an outbreak of whooping cough, any of those things. So in addition to getting flu and COVID vaccines, some people have fallen behind on routine immunizations for their children. And we really want to make sure all the kids are up to date.
So while you're on that topic, and I thank you so much for giving that background, as a pediatrician, what are those warning signs where parents really should bring their infant into the hospital rather than an urgent care? What are the specific signs in a newborn or an infant?
So as I mentioned, very young infants with RSV and sometimes some of these other viruses like influenza can stop breathing. But really more commonly, we're going to be looking for respiratory distress. The first sign will be that your child is breathing faster than normal. You might see that their chest is drawing in, their nostrils are flaring. All of those are signs that they might be having respiratory distress. Other things that you should worry about are if your child seems to be getting dehydrated or is just not acting appropriately, is seeming too lethargic or difficult to arouse. That would be something to bring them into the emergency room immediately for.
So you immediately looked and noticed that your child or infant's crying, but they have no tears. They're probably dehydrated, or also some cyanosis around their mouth, some bluish color. It's really important that you get care right away.
And so we really, again, we want to make sure that parents appropriately send their kids to the hospital when there are urgent needs, but we also want you to utilize all the other resources when there's non-emergent situations, just to reduce the impact on our local hospitals. So that includes doing a telehealth visit, or even while you're waiting in the ER, sometimes you can also do a televisit to see if your concern can be addressed. With your pediatrician, your primary care provider, or urgent care. You can also go to your primary care provider. If you have a child with asthma or has already high risk type conditions, you can also start communicating with your pediatrician to make sure you have an asthma action plan so that you're prepared ahead of time. And also just want to make sure people are aware, I know this question did come up. What do I do if my child is uninsured and my child needs care, whether it's on the outpatient setting or even the inpatient setting? Please get seen and know that there are, if all children technically are eligible for care, you can call our SSA call center 800-281-9799 to get assistance with that and to get benefits for your child. But whenever a child enters the hospital, whether it's CHOC or any of our other hospitals, whether or not you have insurance, they will be cared for.
Great. Our next question comes from Tess Sheets. Tess?
Hi, this is Tess Sheets with Orange County Register. Just a couple questions. I was hoping somebody could please confirm, there was mentioned that there were 11 patients in the ICUs. I'm sorry, is that 11 total in both hospitals, both CHOC hospitals? And are those 11 patients with RSV? And on that topic, like, how long are these patients with RSV in the ICUs staying there? Are they on ventilators? Like, how are they being treated? And then a separate question, in terms of the RSV, like treatments and vaccines that are being worked on right now, I was hoping somebody might be able to speak to like how promising those look, maybe timelines. There was a story in the New York Times that mentioned one vaccine being developed by Dr. Colleen Cunningham with CHOC. And maybe somebody might be able to speak a little bit to that being developed and what that's kind of looking like timeline wise. Thank you.
I can address the piece to start off with about treatments and vaccines. So right now we have a preventive monoclonal antibody treatment called Synagis that we give as a monthly injection to our premature infants and some of our other high-risk babies. Usually we give that from November to April based on our normal RSV seasonality. One of the things that's had to happen with this unusual timing of our RSV season is that we have had to change the timing of that whole clinic and start earlier. So we started in September, October, rather than waiting until November. That treatment will probably be improved upon by a monoclonal antibody, also preventive, that will be able to be given once in the season, hopefully in the next few years, to some of those very high-risk babies. But a lot of the RSV that is coming into the hospital are not the premature babies. And so, of course, ideally, we would like to have a vaccine. The vaccine thus far is being trialed in the elderly. As Dr. CK mentioned, RSV can also hit the elderly pretty hard. If I remember correctly, there are 10 to 20,000 deaths a year in the elderly in the US per year. So the vaccine is first being trialed in the elderly and hopefully will be available in the next few years. Pediatric vaccine may take a little bit longer, but I'm very hopeful that we will soon have one. And of course, that will be a great boon for all of us. Melanie, do you want to answer the piece about the children in the intensive care unit?
Yeah, I think she was asking about the number 11 that you said were in the ICUs. I believe they all have RSV.
Yes, that number was all at Orange. Yes. And all in the ICU with RSV. A little bit difficult, I think, at this point yet to say how long they're going to be there, honestly. And I do not have the exact number of how many of those are on a ventilator versus what we would call BiPAP versus high flow oxygen. I don't have that number in front of me.
But needless to say, we have a lot of patients on high flow and on oxygen throughout the hospital. You know, we are just so fortunate to have the staff that we have, the providers, the nurses, the respiratory therapists. They're so expert at the work we do for children. And I just want to very quickly say a shout out, a big thank you to every one of them. We all appreciate everything you do. We appreciate them coming back day after very long, hard days. We are truly a group of defenders of the childhood.
Great. So we just have a couple questions left, and these are written. We have David Gonzalez with ABC7. He says there's no RSV vaccine. What do the health experts think about data from a new Pfizer study that found vaccinating pregnant women helped protect their newborns against the virus?
So as I mentioned, there's not a pediatric vaccine available yet. I hope there will be someday. And vaccinating pregnant women works for a lot of diseases. It prevents neonatal tetanus in many parts of the world. It is great for preventing whooping cough in young infants and preventing influenza in young infants in those first few months of life before they can be vaccinated or have gotten their full series of whooping cough vaccinations. So it's a great way to protect babies in the first few months of life. Hopefully when that RSV vaccine is available, that may be one strategy for preventing infection in young infants.
Great. And we have time for one more question. It looks like it comes from Mike Valerio with CNN Los Angeles. He says, I heard on the radio this morning that some Orange County pediatric hospitals may have to use outdoor tents because of the RSV surge. Is that report accurate, or is there more nuanced details we should provide?
Well, it's certainly something we talk about. So when we do get surges, whether it's RSV or something else, we first look at every space inside our facility or facilities, both hospitals, and that's what we're doing right now. We are planners. So we're always looking at whether if this gets really bad, are we going to have to set up a field hospital or a tent? At this point, we are not. We are certainly have plans together if we need to do that, but it doesn't look like we will need to do that. I think we are extremely creative and are able to care for children inside the hospital.
Great. Thank you all for your questions. Julie?
Yeah, thank you, everybody. We sure appreciate your time for attending today. We thank our medical providers, our medical doctors that are here today sharing this information. I have put an email contact in the chat for both our HCA communications office as well as for the CHOC communications office if there's any additional questions. We will also download this recording and make it available on our website, and we'll share it with the CHOC team as well to share as they're able to. So we thank you for your time today, and with that we will bid you a good afternoon. Thank you, everybody.
Thank you,
everybody.